Welcome to a brief conversation on burns. And burns first aid. The definition is rather lengthy. A burn has been defined as an injury to the skin or other organic tissue, primarily caused by heat or due to radiation, radioactivity, electricity, friction, or chemical. Could you have an ice burn? Yes, that is an extreme of temperature.
Burns are classified as first, second, and third degree, or superficial, partial, and full thickness. Important is not only identify the type of burn, but surface area affected. Or does the burn involve vital organs? Has it affected the airway? To estimate the burn area, we could use the Palmar surface rule as an estimate. The area in red is the percentage. This is important to relay to the emergency services, or the rule of nines. It's a bit complicated, you may need a chart as reference. Does it involve the airway or other organs? Basic first aid overview. Cool the burn to get the heat out of the tissue. Also to assist in pain reduction, once you have cooled for at least 20 minutes. Then consider covering with a non-stick dressing. Minor burns may be suitable for aloe vera burn aid gel. However, for severe burns, cooling and covering with a sterile non-stick dressing is desirable. Perhaps even a clean triangular bandage may be suitable, even moisten this. Be prepared, the pain and shock can be very disconcerting to deal with. Remain calm and logical. If serious, call emergency services as soon as possible. If it is an ice burn, perhaps room temp water. If it is a chemical burn, flood the chemicals off. Be careful not to contaminate yourself. Let's reinforce the first aid again.
Burns first aid. The best is cool under gentle running water, about 20 minutes. Watch you do not overcool. One question is, do we remove the clothing? Only if it is not melted or embedded in the skin. Do we remove jewelry? Only if it's not involved in the burn. After the cooling process, we may need to cover the burn, reducing infection and pain. Monitor the airway. If involved, perhaps a cool cloth to breathe through. The pain can be normally intense. If authorized, administer some analgesia. Can you use cling wrap for a burn? Perhaps only after substantial cooling. Drape it gently. Do not wrap the cling wrap around a limb. Oxygen may help if trained. They will be in shock, manage that. Call 000 if serious.